Please note that if you or someone you love or care for has a wound, they should consult their own physician to find out the best course of treatment for their wound. Diabetic wounds occur in patients who obviously have the diagnosis of diabetes. Patients with diabetes have a predisposition to developing wounds, specifically in the lower extremity or foot. Over time, uncontrolled blood sugars may cause changes in the lower extremity blood supply. They can also cause changes to the nervous system of a diabetic patient and other factors within the lower extremity that predispose patients to developing these diabetic foot wounds. Proper foot care is paramount in the prevention of these wounds. Now, if these wounds do occur in patients, they can be very, very serious. A diabetic foot ulcer, even though it can be small and dry and look non-infected, can rapidly become a significant wound in a patient. And of the 300 million people who live in the United States, about 30 million are diagnosed with diabetes. Each year, 25% of patients with diabetes will have or will develop a foot ulcer. Of those patients who develop a foot ulcer, 1 out of 7 can end up with an amputation. And then if you do have a lower extremity amputation, then the chances of survival significantly go down. So our goal as wound care practitioners and caretakers, or even family members or patients, are to prevent a lower extremity amputation. And so for that, we need to really take good care of wounds. We need to examine the feet on a daily basis if there is a wound, and perform proper wound dressings and proper wound care changes for patients so that we can prevent the unnecessary decline of wounds. Now, if you're following an excellent nutritional plan and you are coherent with your diabetic medications, then the chances of wound healing can go up.